Hi, my name's Dr. Janice, and I'm here in my aesthetics clinic based in Hillsborough near Belfast. Today, we're going to talk about polynucleotides. Polynucleotides are a skin boosting treatment that is derived from DNA that is purified and originates from either salmon or trout. This injectable treatment is a regenerative type treatment which creates more elastin, collagen, and hydration in your skin. It's not a filler, it's a little bit more like a filter for your skin. It improves skin quality, elasticity, glow, and bounce. Once injected into the skin, polynucleotides target fibroblasts, stimulating them to produce more collagen and elastin. They improve hydration by binding to water in the skin, reduce inflammation, and support tissue repair. Over time, they strengthen the skin barrier. So rather than a quick fix, it's about long-term skin health and rejuvenation. Polynucleotides would be ideal for you if you're starting to notice fine lines and crepiness in your skin. They're particularly good for the fine, delicate skin underneath the eye, dark circles, and also neck, hands, and other areas of the face. If you're not ready for filler, this might be something that you would consider. The treatment itself is straightforward. It involves a series of small injections placed just under the skin. Most patients find this very comfortable, especially with some numbing cream. You may have some mild swelling or small bumps immediately after, but they typically settle within 24 to 48 hours. Results are not instant with polynucleotides. They are a regenerative treatment and require a course of at least 3 treatments spaced 3 to 4 weeks apart, and the results build over time as your skin starts to work just that little bit harder. In my clinic, I often combine polynucleotides alongside other treatments to give you great results. For example, they can be combined with anti-wrinkle treatments, fillers, Tixel, and platelet-rich plasma. If you feel like polynucleotides are something that you might be interested in, get in touch.